Happy Friday, everybody. Welcome to my stress survival camp. Say that 3 times fast. I got the idea to do this because everyone is on lockdown to some degree or another. And in assessing the needs that I could fulfill as a provider and experiencing some additional stress this last week, I decided that the best thing that I could do was utilize my skills as a functional medicine provider and give you some tools to use at home in the next few weeks. And some of, I think, what's causing the stress is we don't know exactly how many weeks, but also to take those skills and to use them after all of this is done. So that's my goal in the coming days. We're going to be doing a Facebook Live every probably morning if I can pull it off and get Parker to stay occupied. And please interact. Obviously right now I'm doing this from my phone. Facebook, after I did a talk on depression, I can no longer link my video to my Facebook and do a Facebook Live. I'm not saying that it was intentional, but there have been technical difficulties. So I'll probably be doing it from my phone. I'm going to try and figure out if there's a way that I can do some interactions, see how tech savvy I can get. But if you have a question or if you have a comment, this is supposed to be interactive. This is not necessarily just for me, this is for you. And you're going to get more out of it if you're willing to share, if you're willing to be honest. I think a lot of us that have experienced anxiety or depression, we don't know how to ask for help. We don't maybe think that we need help. Like a lot of things in the body, how you feel gradually changes. It's not like one day you feel amazing and the next day you feel horrible. It's more gradual, so you kind of forget how good you should be feeling. And that's some of what scares me, in addition to obviously what's going on with the virus that's out there right now, but it's the isolation. And I think it's going to be causing quite a few additional problems for all of us. So that's what we're going to talk about the next couple weeks. So for those of you that don't know, I know we have some people in the group right now that are not firsthand associates of mine, but I am Dr. Jordan Leisure. I am a functional medicine chiropractor. I own a clinic in the northern suburbs of Chicago, and my background is definitely in gut health and how the body works as a whole. So that's what we're going to talk about. We're not just going to sit here and complain and dwell on what's going on. Hey, Christine. But we are going to take some actionable steps. There's going to be some homework. I hope that you find that beneficial. I'm going to add some tools that I've utilized, and I'm also going to add some things that I hope that you request. Again, this is for you, so think of this as, under normal circumstances when I'm seeing patients, it runs anywhere from $400 to $500 an hour. So this is my give back. If there's a question, if there's something I can answer, I will do my best to give general recommendations. If you are not a patient and we don't have that established relationship, I can't give specifics, but I can let you know how I address conditions like that and what I would recommend that you do either for immediate relief or maybe for, when you're able to address this when the quarantine is lifted and you're able to get back to some normal, hopefully better activities. So what I want everybody to do tonight is to take some time and introduce yourselves and share as much as you're comfortable with. For me, my mother will tell you that I probably was depressed from the time I was 11 or 12 when my grandfather passed away. And I had some interesting circumstances in college. I had a stalker in college. I switched undergrads quite a few times, trying to find my niche and where I felt safe and was able to learn. I graduated with my bachelor's in business and chemistry from Lake Forest, and then I got my doctorate from Palmer in Iowa. So that's my scholastic background. When I was 20 and I did come home from college, after that circumstance, I was on a handful of antidepressants, and I will tell you that I never did drugs and I had never drank, and I didn't like the way that made me feel. The antidepressants that I were on, I don't think that they really, at the time, and again, showing my age, this was 20 plus years ago, they just prescribed sort of, whoever took them out to lunch. That was the antidepressant of the day, and whether it was Paxil or Wellbutrin or whatever it was. And some of the label warnings on those products are suicide, homicide, which is a little disturbing. In addition to obviously, GI upset, sexual dysfunction, some of the other things that probably a lot of you on here have experienced. I have a visitor in my talk. Do you want to come inside? Yeah. Okay, come sit in my lap. So I decided that I didn't want to feel that way. I felt like my body wasn't doing what my brain was telling it to do. So I went ahead and took myself off of those things, which I do not recommend as a provider and as a patient. My recommendation is if you're not feeling well and you don't feel like your medication is working for you, that you always discuss it with your doctor before you seek outside means. It's also important to communicate that you are interested in taking supplements, or you are taking supplements. Whoever's treating you needs to have the full and complete picture. So always make sure you're honest with any providers that you're seeing for any of this. So what I decided to do is take myself off everything and do as much research as I could, again, as a 20-year-old, not really knowing what my options were, and found that diet and exercise individually is actually proven to be as effective as taking an antidepressant. Mommy. Yes, baby. I know. Well, you can show me in just a sec. So it's important to make sure that you exhaust all of your options. And you may even find that incorporating exercise and dietary changes, which we're obviously going to dive a lot deeper into in the coming days and weeks, will actually help your medication work more effectively. So make sure that you are open to other options as well. Even if you feel like your medication is working and you feel great, it's meant to be a short-term fix, and then get you to feel good enough to start implementing some of those lifestyle modifications. So keep that in mind. We're gonna talk a lot about what you can do aside from diet and exercise. We're gonna go over breathing exercises. We're gonna go over gratitude journals and the research that shows how great those can be. Even if you're feeling wonderful, you don't need to be feeling like this is the end in order to implement some of these changes. There are some very, very definite unknowns these days, and I want to make sure that we are all, keeping our head above water. That's the purpose of this. So if there are questions, let me know. We're going to talk about how stress impacts your adrenals, how stress impacts your thyroid, how stress impacts your gut, and how stress impacts your brain. All of that, of course, is going to impact your neurotransmitters, which are in control of how you feel, as well as other hormones, so your sex hormones. I have a lot of patients that are currently perimenopausal or menopausal, and they attribute how they feel to just the typical, I'm in menopause and this is aging. And you don't have to feel that way, but your stress, if it's out of control, will definitely impact those hormonal changes as well. So we cannot change the stress that we are exposed to. However, we can change how we react to it. So if you're up for camp, you tune into the right place. Again, if you have suggestions of things that you would like to have covered, feel free to post it in the group, or if you want to send me a private message, you can do that as well. If you have a question or something that you would like to share but you don't want to associate your name with it, feel free to, again, send that privately, and I will share that as an anonymous post, and that information will obviously stay between you and I. And if there's any suggestions that you have, I would love to know, because again, this group is for you. I am at your service for the coming weeks. And if there is any information here that you find beneficial, please share, because you never know who needs help. You never know who doesn't know how to ask for help. So in my experience, the best thing to do is to share it with everyone. And then those that this resonates with will join our group and participate and help each other. So again, I love you all. We are gonna get through this one way or another. I myself am a small business owner. I have friends on here that are small business owners. I have friends that are in big industry that have been laid off just because their industry is worried about, again, the unknown. and that's a very, very scary place to be. But we're gonna incorporate some tools, and we're gonna manage so that we come out of these next couple weeks healthier, stronger, and we're gonna hit the ground running. So I love you all. If there's anything you need in the interim, feel free to message me and I will get that schedule up ASAP. I love you. Thank you for the support, and we will see you tomorrow. Bye-bye.